Hi everybody. How are you this evening? I'm checking my internet connection, so while we're working on this, let me know where you are tuning in from. If you are watching live, if you are watching the replay, let me know what is going on. I am Dr. Jordan Leasure. I'm on a new phone, so again, that's why I feel like this is so close, but we'll see how technology works tonight. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. I'm a functional medicine DC, and you are in my stress management boot camp. And if you haven't seen, hey Nicole, thanks for stopping by. If you haven't seen the other videos, check them out. You know, the goal of this group, as always, is to provide information to help you manage all of the new stressors that we are affected by lately, including being locked up. It's like Groundhog Day. I don't even know what week we're on. I think like week 7. It's been going on since St. Patrick's Day. That's my benchmark. And not necessarily an end in sight. I'm using May 1st. I don't know. Our anniversary party for the office was supposed to be the first Friday in May, and it's looking like, I don't know. I don't know if we're going to be let loose by then, and at what point people are going to want to be congregating together. Who knows? Again, off on one of my tangents. But the purpose of the group is to help you manage the current stress that's going on, as well as the chronic stressors that you have and will continue to be exposed to for the rest of your life. We discuss the difference between real and perceived stress, as well as how all of those things impact our organs, all of our systems, and especially right now, our immune system. So tonight, we are talking about mold. This topic came up in a private conversation, and I thought that we would expand on it in a quick video. And essentially, the gist of this is all of us that are quarantined at home are spending about 50% more time in one location than we're used to. If you think of yourself under normal circumstances, even if you're someone that works from home, you typically have the opportunity to leave. You are driving, you're spending time in your car, you're spending time maybe at the coffee shop, you're bringing kids to school possibly, you are engaging in recreational activities, you are working out, you get the gist. You're in other places. Now you're spending, for some people, 100% of your day inside. Hey, Erica. So what does that mean? You are being exposed to, depending on where you live, you're being exposed possibly to toxins at a much greater rate than you are under normal circumstances. And mold especially, I'll run through a list of a handful of household toxins that you should be aware of and places you should look. But mold especially is toxic, and how it displays among individuals varies. So someone with mold toxicity can display signs and symptoms of GI upset. They can display signs and symptoms of skin eruptions. It could look like eczema, different environmental allergens, or what I wanted to hit on tonight was it can exacerbate or be the sole cause of anxiety, depression, brain fog, memory issues, recall, anything related to the brain. Mold in the system is going to clog up your functioning. So it's very serious, and you want to make sure if you have been tested yourself for mold, if you have been treated for mold, you need to make sure that you are treating your environment. Because I guarantee if you have gone through a protocol and cleansed yourself and healed your GI, but you haven't done anything to address the environment, you've probably been recolonized, unfortunately. There are a handful of household areas that you want to be paying attention to, especially for those of us in the Midwest where we are inside. You know, we don't have the opportunity, you know, snowing today, hence my get up. But we don't have the opportunity to get out as much. You know, we probably don't have a pool. And if we do, we're using it for 1 month a year. But under these current stay-at-home orders, you want to be paying very close attention because you are spending so much more time at home than you were before. So take a look at the humidity, and I am not an HVAC expert by any means, but the humidity in your home should range between 30 and 50. So if you have the ability to check that, I think that they sell, you know, cheap sensors. Take a look and see where that is. And if it's too low, it's going to be too dry in your home. And obviously, if it's too wet, if it's too moist, you are going to create an environment where more mold can be growing. So you want to be very, very careful with that. The HVAC system is, of course, the lungs of the home. So you want to make sure that that is routinely cleaned, that you are changing filters, that you're using appropriate filters. HEPA is the way to go, so that you're taking out some of those allergens. And especially if you have animals in the home, or you've purchased the home and there's carpeting, things like that, and you don't know the whereabouts of, or excuse me, the whereabouts, you don't know the habits of the owners prior to you, cleaning out that HVAC system is a great idea. Crawl spaces are notorious for moisture, so if you're able to get in your crawl and take a look and see, is it damp? Is the sealant, does the sealant go all the way up the wall, or did they just seal the floor? That's a problem, because it's going to suck in moisture from the ground. Again, for those of us living in the Midwest, other people aren't going to have quite as much of an issue, but that's a very good place to start. Underneath cabinets in bathrooms and kitchens is also somewhere where you're going to be wanting to pay very close attention. I very irregularly use anything under my bathroom sink, so I'm not routinely looking for drips. If something is dripping or collecting water, I'm not going to notice it until it's probably a problem. And same with my kitchen. If I reach under and I get soap to wash dishes, it's a very quick thing. I'm not investigating regularly, which we want to make sure that we do. There's different things you can buy. There's different moisture sensing pads where a little alert will go off if there is a drip, and that may be something that you want to invest in depending on the size of your house and how serious you want to take these concerns. But also just being aware. Do you notice a smell in different areas of your house? Does the basement smell musty? That's very common. And this is actually going to be tomorrow's topic, the difference between common and normal. So it may be very common for basements to smell musty. That's mold. So that's not okay. And that's something that can absolutely colonize you, affect your children, have lung issues like asthma and allergies and all of those things, which again, are especially important while we're working on fighting off this virus. So look for smells. If you notice that when you spend, maybe there is no smell, but you notice when you spend time in your basement, you don't feel very good, you start getting tired, or your sinuses are clogged up, or vice versa. Let's say that you're upstairs in your master bedroom or your master bathroom, and your sinuses are having issues. There may be a leak, and there may be something that is unseen. So definitely having somebody come in. There's awesome technology now. They use digital cameras and different sensors. And again, not my area of expertise, but have a professional come in and take a look and see what's going on so that you and your family are very well protected. A few other quick notes while I have you. Take a look at houseplants. Houseplants obviously can easily grow mold. Keep on the dry side to decrease mold. So you don't want to overwater, you don't want water sitting there. Keep out of the bedroom, especially because again, you're spending so much time in there that mold can be sensitizing. Christmas trees, of course, are going to grow mold. And then obviously these are going to be live ones, which we're not going to have to worry about for a couple months. And blue jean buttons. And this is, we're going into some other allergens, some other sensitivities I want to talk about, but blue jean buttons are nickel, and that is a very common allergen. Sorry, my notes are not behaving. So what you want to make sure that you're doing is maybe using a clear nail polish to go over those. Hey Kelly, thanks for hopping in. A clear nail polish over those jean buttons or any other pants buttons so that you don't have that sensitivity from those. Perfume, of course. Perfume contains VOCs. I've hit on this earlier. I'm a big fan of essential oils. I'm actually placing a Young Living oil order tomorrow, and I'm trying to decide what other spring-like scents I need since we're not getting spring here in Chicago apparently. But if you can, utilize essential oils in lieu of perfumes or candles so you're not exposing yourself or your family to these VOCs, these organic compounds that actually can be cancer causing. They're very toxic. What else? Soaps and detergents. Take a look at what you're washing your clothes with, what you're exposing your kids to, and allergens can develop over time. So if you start having an issue with your skin, if you're having something that appears to be eczema, it's not necessarily something outside the home. It could absolutely be the same detergent you've been using for 10 years and you have now broken down your gut enough that you've created a sensitivity to that product. So you may want to take a look at what you're using and if possible switch to something a little safer. What else did I want to discuss? Carpeting, of course. Again, you don't know who's used that carpet for what, and even if it's only been you, it will absolutely collect dander, it will collect pet hair, it will collect everything, and they can be challenging to clean. So if you're worried about cleaning up the home, eliminating carpeting may be a really good option. And then what else? Wall paint, of course. You know, I unfortunately moved twice in a year and we painted both homes, so we were exposed to a lot more of those toxic VOCs than I would have preferred. So making sure that if you're painting in a season where you can leave the home open, you can leave the HVAC system running so you can get those VOCs out. Don't move in until you have to. And if you're painting a small area and you are currently living in the home, do your best to not occupy that area for a few days, and actually a few days longer than you think. So if things are still smelling, they are still off-gassing the VOCs, and it lasts a lot longer than you would anticipate. Beer and alcohol, of course, can be high, and nobody wants to hear this now, can be high in toxins because they are coming from oats and corn and rye. Some of those can grow molds, they can cause an allergic reaction. They are high in sulfur dioxide. For individuals that are sulfur sensitive, that can be a very, very big problem. And dry cleaning clothes. This is a high source of toxins, and you want to take a look at a company. There are a handful, and you just have to do your research, that do cleaner dry cleaning, which is kind of funny. But it contains less toxins, which again, if your clothes are off-gassing, if things are smelling, even if it's a pleasant smell, so your cleaning products, what else? Laundry. I mean, I try to even stay out of that aisle when I shop because that is literally toxic chemicals that are causing cancer. So, and this is not my opinion. This is all researched. So please, please limit or eliminate any of those things that are sweet smelling because they are going to be toxic to you and your family. If, again, you can take a look at your HVAC filters that you're using. They should be changed about every 3 months minimum. Change with the seasons if that's easier for you to remember. But if there's any questions, let me know. Again, mold, was tonight's topic because it is ubiquitous. It is found, again, almost everywhere. And one way to make sure that you and your family are protected is to be aware. So look around. Now's a good time. Unfortunately, we are stuck at home. Hey, Jess. So do some research and see, poke around if there is any smell that you notice. See how you're feeling in different areas of the house. Be aware of your mood, your motivation, things like that prior to this shutdown, because it may not just be the stress of the unknown. It may be, some toxic mold in the house that's contributing to mood disorders, that's increasing anxiety, that's negatively impacting how you're feeling. And obviously, again, the body's very complex. So it could be a lot of different things, but don't rule mold out until you've given it a really good look and a really good consideration. We do organic acid testing in the office, which is very cool. I actually did a panel on myself so that I had a sample to show patients. It's a urine test, and it's kind of funny because it reads the metabolism of cells. So when I explain it to patients, I call it the poop of the poop because it's the metabolism of all of your cells. So it takes a look at vitamin levels, it takes a look at different protein levels, it takes a look at if there is bacteria, if there's a virus, if there is mold, for instance. And it's very, very cool at what it does. There's a couple vitamin levels thrown in there, but I call it the poop of the poop because it's metabolites. So it's essentially all of these systems, how are they running, and then all of the leftover, essentially poop, of the system. And maybe it's confusing because it's a urine test, but to me it makes sense and it helps people understand what we're looking for. Anyway, I had a patient a few months ago who has had a chronic cough for probably 2 years. And she feels better when she goes on vacation. She went to her primary care with the cough and they didn't have an answer. They sent her to a cardiologist, or maybe they sent her to an allergist first. They sent her to an ENT who didn't have an answer, sent her to a cardiologist who didn't have an answer, sent her to a gastroenterologist who didn't have an answer, and finally, I think, circled back to her primary who gave her an antidepressant because they told her that the cough was in her head. That's good medicine. So, and during all of this, I was very frustrated as a provider because I, in my heart, knew the answer without even giving her a test. So we did the organic acid test and it came back positive for both mold overgrowth and candida, systemic yeast. So, very simple answer. And again, because mold can result in brain issues, in cardiovascular issues, in GI issues, in skin issues, it can, for some people, be hard to diagnose. And I think there's other practicing allopaths that don't want to recognize that the source of a problem is outside of the body. It's not the body like malfunctioning. So pay attention to yourself, trust yourself. And if you're not getting a good answer from a doctor, I always like to tell my patients that doctors work for you, not vice versa. So you need to make sure that they are doing their due diligence in serving you appropriately. I am heading out to try to put Mr. Parker to sleep. And if there are questions regarding mold, regarding how mold can impact your health, feel free to send me a private message. And as always, talk amongst yourselves. This group is for you to make sure that we are keeping each other accountable, keeping each other healthy. I hope that you guys have been thinking about your goals. That was our video yesterday. And stay tuned tomorrow. I had a talk with a friend who is actually COVID positive, and she is, knock on wood, happy, healthy at home. Both her and her husband tested positive. So they are, riding this out, unfortunately, suffering, I would say a little bit, similar to a flu. It sucks to be sick. It doesn't matter what you want to call it, but they're doing well, and we discussed some remedies and some options for them at home. But out of that conversation came tomorrow's topic, which is going to be the difference between common and normal. So stew on that this evening. Come up with some questions because I expect more interactions from all of you guys. This is much more fun when it's two ways and it's not just me speaking, to myself. So let me know what questions you have. If you have concerns, if you have topics you want to hear about, you can either post them obviously in the group or send me a private message. If you have a question that you would like to poll the audience, I'm happy to post anything confidentially, anonymously. And if you have something you'd like to ask me, again, feel free to send me a private message. We've got some really cool things coming up this week. I'm super busy with media appearances, which is super fun, and videos for some of our supplement companies and publications. I'm actually doing 2 virtual health fairs, which is awesome. So if you work for a company, maybe run that by them and see if they'd be interested in doing that. I think it's a fantastic bonus for companies to offer during this time when they can't do a lot of HR support because you're working from home. So if I can be of assistance in that arena, please feel free to reach out. Otherwise, I love you all. Have a wonderful Tuesday. And fingers crossed, if you're in Chicago, the sun comes out sometime this week. And otherwise, I'll be braving the snow with Mr. Parker. So love you all. Have a great night. We'll see you tomorrow. Bye-bye.